why we think we're live, because we turned the phone around today.
See, we can see it correctly now. We're slowly fixing things. Now it's not dyslexic or upside down anymore. But the chairs, they're still no good. And she won't get me a new chair. I want a new chair that makes me look taller, thinner, and gives me more hair. But she refuses to get me a new chair. So these are uncomfortable. At least I'm uncomfortable. She won't get me a new chair.
30 minutes out of your life once a week.
No, that's true.
Really, it's not that bad, guys.
You know, sometimes I did a gastric bypass in 30 minutes. Well, the patient's not very big and it's easy. So this is as painful as that. No, I love it. So we're gonna fix the format a little because we got taken to the woodshed because we didn't answer some of the questions last week because I kept talking and talking and talking. So our new protocol is our new protocol is the minute a question comes in, I'll stop hackling, lecturing, pontificating, and we will answer the questions. And now we're gonna answer all the ones we didn't answer last week. First thing.
All right. So. Okay. Doctor, estoy muy triste con mi hermano. Él necesita de esa cirugía, pesa como 400 libras. Por ayudarme, él no se siente bien de salud. Quisiera que lo vieras. Espero su respuesta. Gracias.
Enseguida que quiera podemos hacer un virtual con una de las coordinadoras. Es súper fácil. No tiene que venir aquí. Simplemente una llamada telefónica. Platico con él. Le digo preliminarmente la información. Y entonces si decide seguir, le damos una cita y nos ve personalmente en la oficina. Todo el mundo que quiera opinión, que quiera platicar conmigo, se deben operar, no se deben operar, cuál operación recomiendo, etcétera, es bien fácil. Una consulta virtual completamente gratuita, 10 o 15 minutos de su tiempo, casi todas las tardes, y lo hacemos, y ahí le puedo dar la información preliminaria para tomar esta decisión. Pesando 400 libras, sinceramente es algo que debe hacer porque eso destruye la salud. Muchas personas me preguntan, ¿cuándo es el mejor momento de operarse? La sincera verdad es mientras más joven y menos pesa, menos daño ha hecho, más fácil va a ser la cirugía. Yo le digo a las personas, no esperen a llegar a 400 libras. Cuando estén llegando a 250, 300, que saben que están sube, es el momento de hacerlo. Ya cuando llegan a 400, 500 libras, lo puedo hacer y lo hacemos bien exitoso, pero es más dificultoso, más doloroso, etc. También, si están sobrepeso con enfermedades, esperar otros 5 o 10 años simplemente va a dañar más órganos y ese daño a veces no se echa para atrás. Sin duda para de avanzar, pero no se echa para atrás. O muchas veces es mejor operar temprano, una persona relativamente joven, antes que haya dañado los pulmones, los riñones, la circulación, para prevenir llegar ahí. Si tiene un BMI más de 35, no espere. Ya después de 18, 19 años se debe operar.
Nada más para explicar un poquito sobre el proceso, una persona que está interesada en tener la cirugía, aunque no sepa si es candidato o no, puede llamar a la oficina o dejar sus datos a través de un mensaje directo en Instagram, y una de las coordinadoras va a hablar con el paciente o el familiar del paciente, quien esté llamando, para coger los datos. Le va a decir si es candidato o no para la cirugía. Y si es candidato, entonces puede agendar la llamada con el doctor Sosa completamente gratis. Esa llamada, entonces va a hablar con el doctor, van a hablar sobre sus medicamentos, su historial de cirugía, y le va a decir cuál cirugía es adecuada para usted y si puede tener la cirugía o no. Todo eso se puede hacer sin compromiso.
Exacto. Y fácil y barato porque es cero costo.
Sí. Okay. With the surgery, is it true that you have to, for the rest of your life, take vitamins and supplements?
So vitamins, yes. Supplements are good for you. We teach you. The thing about supplements is they can improve the quality of your life, your function. They're not necessary to stay healthy. Vitamins are necessary to stay healthy. Now, in the US, it is recommended that every adult should take a multivitamin a day. So with bariatric surgery, that just becomes mandatory rather than a recommendation. So you must take multivitamins, a good multivitamin. We're going to teach you what a good multivitamin is. Now I tell people, if you go on vacation, if you forget for a few days, nothing happens. But if you spend months without taking any of your vitamin supplements, you're going to get a deficiency. What does deficiency cause? Anemia, the nerves don't work as well, you're run down, you're weak. Very easy to prevent. Make the habit of taking a multivitamin every day. I take a multivitamin every day. There are days that I miss because it's sitting by the counter when we have breakfast. Occasionally, we're in a hurry, whatever. We don't have breakfast at home. I don't take the vitamin that day. But as a routine, I take my multivitamin every day. So, and people sometimes go to me, oh my God, I have to take a multivitamin. I laugh, I go, you're a metformin and Alapril, cardio, and I'm going to get rid of those, but you have to take one multivitamin. It's a pretty good deal to take a multivitamin and be much healthier.
Absolutely. And if you use our vitamin that Dr. Sosa formulated himself, the gastric bypass patients take 2 a day, and the sleeve patients take 1 a day. And if you did not have bariatric surgery and you want to use our vitamin, you take 1 a day.
That's the one I take.
We take our own vitamin.
I take my own vitamin once a day for breakfast every day.
Yes.
Occasionally I forget.
¿Una persona con problema hepático puede operarse?
Sí, es más, uno de los tratamientos más eficaz para lo que se llama fatty liver disease, tiene varios nombres, non-alcoholic hepatosteatosis, etc. Uno de los tratamientos mejores es la cirugía bariátrica. Mientras el nivel de daño no sea avanzado, o sea, no haga una cirrosis tipo B, tipo C, una cirrosis tipo A hasta se puede operar, una cirrosis temprana. So, definitivamente para hígado grasoso, enzimas elevadas un poquito, cirrosis muy temprana, la cirugía se puede hacer y es buena. Cuando la cirrosis es muy avanzada, ya hay ascitis, ya hay presión elevada en las venas, ya entonces no se puede operar porque la cirugía es muy riesgosa. So, alguien que tenga problemas hepáticos debido a la grasa, opérese temprano para parar el daño y reversar el daño, que eso se ha estudiado, se ha demostrado. La cirugía bariátrica elimina el daño que se le ha hecho al hígado por la grasa.
Creo que este es un comentario. A ver, sí es el mejor. Yo me operé hace
Gracias.
3 años y bajé 140 libras. No he aumentado. Aprendí a comer lo que mi cuerpo le hace falta y lo logré. Quería que me siento muy bien y ya me quitaron el tratamiento de la diabetes. Muy bien. Y lo recomiendo 120%.
Gracias. En los diabéticos tipo 2, esta cirugía es prácticamente magia porque elimina la diabetes tipo 2. Y la diabetes tipo 2 destruye la salud, destruye los ojos, la circulación, los riñones. Y tenemos una operación que la elimina. So, si usted está sufriendo de obesidad y diabetes tipo 2, esta es la solución.
Do you do gastric bypass revision surgery?
So no. So to revise a gastric bypass to another gastric bypass, I did, and the results were not very good. So we stopped doing it. So you're incurring cost, you're incurring a risk, and the results were not very good. We were seeing another 20, 30, 40 pounds of weight loss, not another 100-pound weight loss. So when the gastric bypass fails, my recommendation is long-term GLP-1s, less expensive, less risky. Now, revising or converting sleeves to gastrics, I do all the time, and they're very, very successful. We thought if you take the gastric and add more malabsorption, make the gastric bypass live longer, we're going to have great results. We have midland results, 30, 40, 50 pounds. For the most part, to lose another 20, 30, 40, maybe 50 pounds is usually, in my mind, not worth the cost and the risk when I know the GLP-1s can do 20, 30, 40 pounds if you had a gastric bypass before. So it's about, not that this is an absolute worthless option, it's about this is a better, less expensive, less risky option, so the GLP-1s are better.
And I think, and if you do the GLP-1 and you combine it with one of our Back on Track nutrition programs, which basically is teaching you how to use your surgery again, because your surgery is still there, your gastric bypass is still there. You just have gotten out of the habit of following the tools that you need to in order to make it work the best possible. And so you combine that.
It sounds like gibberish, but it's really this simple. High solid protein added to a gastric bypass that's failing or failed rescues the gastric bypass. What is high protein solid food? Steak, chicken, hard eggs, and so
Talk about the ball.
Right. So those things give you a ball in your pouch. You get this fullness, and people try to avoid that by eating soft, mushy food. That's how they're cheating the operation. Using the operation means feeling the ball of fullness, and then you stay full 3, 4, 5, 6 hours. So your caloric intake throughout the day drops. You go into a negative caloric balance. You lose weight. So very simple. I mean, it can be very more complicated with diets, but very simple. High protein dense food. The classic steak.
Yeah. Okay. We have
Fresh questions, we're going to take them freshly as asked.
Después de una bariátrica, ¿cuánto es el tiempo de reposo para iniciar a hacer ejercicios?
So, no hay reposo. Inmediatamente después de cirugía le pedimos que caminamos, que se mueva. So, reposo en la cama, eso no existe. Ahora, ejercicio, gimnasio, un mes. Al mes yo le doy lo que a los pacientes para empezar a hacer pesas, resistance training, bicicleta, elíptico. Lo único que le digo que no hagan son abdominales, crunches, por un año, para que sanen bien sólidas las heridas. Pero pesas, todo tipo de aeróbico, al mes queremos que empiecen el gimnasio para ayudar al programa.
Yes. Nosotros, bueno, kind of va con la próxima pregunta que estaba preguntando cuándo vamos a tener otro evento. So, tuvimos un evento hace poco donde estábamos haciendo entrevistas a pacientes que ya se han operado. Y es increíble que después de 24 años que llevamos en esa clínica tratando a los pacientes bariátricos, hice una entrevista con una muchacha que la verdad que lucía espectacular. 3 años después de su cirugía y lucía, tenía un peso ideal, y yo le pregunté, ¿qué fue lo que usted hizo después de la cirugía? Y ella dice que enseguida que tú le diste permiso de empezar a hacer ejercicio, ella empezó a hacer ejercicio y empezó a hacer pesas, que ella le tenía mucho miedo a las pesas, siendo mujer, no quería ser musculosa, y te digo la verdad que luce perfecta, no luce musculosa, no tiene piel, es una muchacha joven por supuesto, no tiene la piel colgando, la verdad que tiene unos resultados que hasta yo me quedé like, wow, pero ella siguió todas las instrucciones, y es increíble lo que se puede lograr cuando uno sigue las instrucciones.
Yo le digo a los pacientes, vas a ser flaco o vas a ser flaca. Ahora quieres ser flaco y lucir bien, ejercicio. Quieres ser flaco y lucir desmacrado, no hagas ejercicio. Tan simple como eso.
Okay. Mi hija está haciendo ejercicios, se siente fenomenal, es operada, es muy buen, evita muchos problemas a largo plazo y el mejor equipo, solo recomendado a todos. Gracias.
Lo más importante es evita problemas. La
Sí.
solución evita la diabetes, el colesterol, el hígado grasoso, la presión arterial elevada. So, evita esos problemas o mantiene la salud a largo plazo.
Okay. So, when is your next event? So our next event is going to be Saturday, November 22nd. And this one is not only going to be open to our patients, it's going to be open to everybody because it's going to kind of be like a health fair. We're going to have a representative from SkinCeuticals here doing skin analysis. We're going to have our own staff doing BMI checks so you can make sure where your BMI is at. And we're going to give you little handouts to let you know what you need to do to get to the right BMI level. We're also going to check and give you, the heart rate for fat burning, right?
Right, so we're gonna calculate your the ideal heart rate that you have to take it depends on your age, where you actually begin to burn fat.
And then you can do Botox that day, we're going to have some vitamin shots, and then we'll also be doing testimonials for patients that
Maybe I'll
would
do my
like to go.
Botox that day.
Yeah, there you go. So, hello doc, just wanted to say hello and thank you for changing my life. 4 years later, down 235 pounds.
That's impressive. Losing 235 pounds, it's impressive. You got props. I take my hat off to you.
And keeping it off.
So, I mean, I tell people I have very extremes of patients. For example, the last 2 days I've done really, really sick people, really high-risk people who I told them, listen, this is very risky. 71-year-old lady, bad lungs, bad heart in what's called congestive heart failure. She's 2 days post-op, doing amazing. The lady looks amazing. I'm hopeful she continue to do that. So yeah, we have some really high-risk people and then some really big folks lately, 400, 500 pounds. Those are the ones that you can see 235 pounds weight loss. That's amazing. And then we have the other spectrum. The people that we're losing 40, 50 pounds are going to look like models. Mm-hmm. So the practice is really interesting because we have a whole spectrum of very high risk, difficult patients, very easy sleeves that are going just to look like models. So it really provides a huge variety in the practice, which is what I like.
Yo llevo 1 año de mi cirugía y es el mejor doctor que he conocido. Estoy muy feliz, todo me fue genial.
Y dicen que soy más genioso, ¿verdad que no?
Sí, la verdad es que a veces es mal genioso. No vamos a decir mentiras en nuestro live.
Es verdad.
Es la verdad.
Es verdad. A veces tengo mala puca, como se dice en español.
Pero
Sometimes I'm a little short because I'm a little stressed and whatever.
no, you're a little short because of your height. You're a little...
No, in English it's called being short.
I know.
When you get angry, it's called being short with people. When you're like, it's called being short. And so, yeah, I am a little short though. So anyway, yeah, sometimes I'm a little short because sometimes people just don't listen to things, you know, and I give them advice and they just don't listen. So it gets to be a little, but.
Yeah, I mean, you know, it's like everything. And I always tell the staff here, you know, try to put yourself, you know, in the position of the patient. And so I'm going to say to you guys right now, try to put yourself in the position of the doctor. When you're giving the same advice for 24 years and you're 100% sure that you're giving good advice because you've done it so many times.
Well, the one that makes me angry, honestly makes me angry, and I've had angry discussions with patients is smoking. I have patients who have ulcers and they keep smoking and they keep being readmitted every 2 or 3 months with bleeding and ulcers. And I'm like, which part of you gotta stop smoking or it's not gonna heal? Don't you understand? And then they'll get mad at me. Don't yell at me. I'm like, but this is beyond the pale. I've admitted you now 3 times taking care of you, and you're still smoking. I go, I'm not smoking. I go, I can smell it. You reek of smoke. Don't lie to me. Well, that's my husband smoking. No, your husband, you wouldn't smell like that if it was your husband. It's you smoking. You gotta quit smoking, and they don't. I go, okay, the next time I'll just keep treating you, but it's going in one ear out the other. So sometimes you guys can get frustrating by doing things you know you should. Mind you, I tell you ahead of time. Ahead of surgery, I tell you can never smoke again. And they all promise me to stop smoking, and then once they don't, they end up getting very, very sick with really bad bleeding. And he's like, you brought this upon yourself. You know, I don't smoke for you. You're smoking. You need to stop smoking. So, you know, sometimes it gets frustrating.
And specifically, you're talking about cigarette smoking.
Cigarettes, nicotine. It's deadly to the pouch.
Yes. Vape. How about vaping?
Vaping is really bad for your lungs because it causes a mechanical problem. All that sucking in actually damages your lungs at the cellular tissue level, and some of the lung fibrosis we're seeing with chronic vaping is horrible. But B, most vapes are very high in nicotine. So if you have a gastric bypass and you're giving yourself all that nicotine, the nicotine damages the pouch and causes all sorts of bleeding. So you gotta stop it. And what I tell people is, you know, vapes have different degrees of nicotine. Start cutting way down until you get to either 0, you know, and then put the vape down or get to very, very low levels of nicotine. But you gotta get off the nicotine. It's habit addicting. If somebody said to me today, you gotta give up coffee the rest of your life, it would be hard, no doubt. But if it's my life depends on it, I would give up coffee. And that's what I tell them about nicotine. You gotta give it up. It's tough, I know, but you gotta give it up because it's destroying you.
Okay, I had my bypass surgery 3 years ago. It has definitely been the best decision. I had a baby a year ago and
Congrats.
was able to get back to my pre-baby weight. I've lost a total of 158 pounds since surgery. That is
Congratulations.
amazing.
That's a success story.
And if you're still on, can I ask you something? How much, if you don't mind sharing, how much weight did you gain with your pregnancy?
I'm gonna guess 30 pounds. Because the people that are successful in losing it, gain 25, 30, 35. Yeah. The people that have a really hard time losing it is the people that gain 50, 60 pounds with their pregnancies.
Because once again, with our interviews that we've been doing with our patients, I've been getting to know our patients a little more in depth. And we did a recent one with one of our patients that got pregnant recently. And she's in that 25 to 30 pound.
That's what you should weigh. That's what you should gain with your pregnancy. 25, 30 pounds.
Whether you had the surgery or
right.
not.
Right, well, you have to figure it out.
In this country, it's very difficult.
I mean, I'm sure your OBs kind of tell you when you're getting a little too much weight, it's like, you gotta watch your diet, you can't keep gaining weight. But some folks gain 40, 50, 60, 70 pounds with the pregnancy. It's not healthy for you or the baby.
Yeah. I think I gained like 35, almost 40.
And that's because I stopped from eating. I would take away the French fries and eat it myself. I sacrificed myself. I ate all her French fries.
But I lost a lot of weight right after. Ok, doctor, buen día. Quisiera saber cuál es el peso requerido para poder hacerme la cirugía y qué opciones tengo. Mi peso es 177.
So depende la estatura y el peso. Hay que hacer la relación del peso a la estatura, porque obviamente si mide 6'5" y pesa 177 libras está súper flaco. Pero si mide 5 pies y está en 177 está obeso o obesa. So hay que ver la estatura y hacer lo que se llama el índice de masa corporal. Si el índice de masa corporal está más de 30, la operación se puede hacer. Cuando es entre 30 y 35, la mejor opción es la manga. Cuando es más de 40, la mejor opción es el desvío gástrico. Entre 35 y 40 platicamos, ¿te gusta el dulce, no te gusta el dulce? ¿Cómo comes? Mucha comida de repente, mucha comida frecuente. Y eso me guía a darle el consejo de cuál les recomiendo. Por eso es la consulta virtual que platicamos. Nos acaban de responder, subió 35 libras con el pregnancy. Yes, and I was right.
Yes.
That's the number that you're going to successfully lose the weight after the pregnancy. 25, 30, 35 pounds. Once you get over 45, it's really tough to get you down before pregnancy weight.
But the other thing I want to say about that is, because I know like a lot of our patients that are young women that are thinking of getting pregnant after having the surgery are worried about not gaining enough weight for the baby.
You will gain enough weight for the baby. There is no reason you cannot get the right nutrition after a gastric bypass when you're pregnant. You got to choose your food well. High protein, good fats, complex carbs, not simple carbs like dessert, but complex carbs. But you can definitely get enough nutrition, enough calories to have a perfectly normal pregnancy. I've said it before here. The studies show that women who start with a high BMI, have bariatric surgery, have much more successful and healthier pregnancies than women who get pregnant with a high BMI. Carrying the pregnancy successful to term is much harder, they're much sicker than they have bariatric surgery and then carry the pregnancy to term. It's been studied, it's been published, it's clear in the literature.
And your recommendation would be to wait how long after bariatric surgery?
The classic recommendation is 1 year. The new studies show that if you get pregnant before a year, the pregnancy is just as successful.
Your weight loss might not be.
Your weight loss might not be, and the number of times you have to see the OB and check the ultrasounds is more because you haven't stabilized your weight loss. But at 1 year, perfectly safe to have the pregnancy, and the pregnancy is much more successful.
Wonderful. And do they keep taking our multivitamin?
Yes. So I always tell them, our multivitamins, the adult multivitamins, are for you. When you get pregnant, the prenatals are for the baby. So you essentially end up taking both. Now, you have to make sure the vitamin that you're taking doesn't clash, that they don't have too much of A or D or K, because those are fat soluble. So ours are very compatible because ours are very high in water soluble, but normal in fat soluble. So if you add normal prenatals, you're fine.
I personally took our vitamins all throughout my pregnancy.
And you think that's why our son is so smart? I think it's
not because of his dad, no.
My DNA.
No. Okay. ¿Por qué da tantas ganas de dulce? Me hice la manga hace 3 meses y me fue excelente.
El cuerpo, cuando está perdiendo peso rápidamente, quiere buscar la manera más fácil de volver a subir de peso. Es un instinto que sobrevivimos hormonal. La manera más fácil de conseguir muchas calorías de repente es el dulce. So, el cerebro asocia el dulce con el mejor chance de sobrevivir. Obviamente nosotros no vivimos en el tipo de sociedad que vamos a pasar hambre, que va a haber sequía. So, dulce nos hace obesos. Pero eso es la razón que el cerebro le gusta el dulce. Porque el dulce nos da mucha caloría, guardamos esa caloría, cuando viene la sequía, cuando viene el invierno, vamos a sobrevivir. So, consumir algo en altas calorías, el cerebro recuerda eso y dice, esto es bueno, esto me gusta, es un instinto para sobrevivir, que ya no lo necesitamos porque en nuestra sociedad no hay sequía, no hay invierno que no hay comida, eso no existe. So, comer mucho dulce ahora es horrible. Comer mucho dulce hace 500 años era bueno para sobrevivir. So, estamos mal ajustados para nuestra sociedad agrícola, que el dulce, que todo concentrado está ahí tan fácil. Y por eso la cirugía se está usando tan frecuentemente para poder interrumpir ese ciclo del cerebro, querer cosas que nos están destruyendo la salud.
Y para una persona que tiene una manga, si le sigue gustando el dulce, lo mejor
Vas a subir de peso.
Pero lo mejor es comer proteína.
Proteína, absolutamente. Trata de eliminar el dulce, porque si con una manga comes mucho dulce, vas a subir de peso. Con el bypass, si comes mucho dulce, te va mucha diarrea, no vas a subir de peso. Con la manga, si comes mucho dulce, vas a subir de peso. El enemigo de la manga es el postre.
So, para combatir eso, te seguro que está comiendo bastante proteína en cada vez que se siente a comer.
Cada vez que te dé esa gana, quiero dulce, búscate un snack que sea alto en proteína. Nueces, otro tipo de snack.
Si come nueces, es muy importante la cantidad de nueces, porque también puede ser alto en calorías.
Pero nunca va a ser tan alto como el dulce.
Yes.
So, cuando hay ganas de picotear, busquen algo que picotear que no sea dulce. Hoy en día hay muchas cosas alto en proteína. Potato chips, snacks, que están diseñados especialmente para ser alto en proteína.
¿Cómo se dice beef jerky? Do you know?
No sé cómo se dice.
Hay unos palitos de carne seca.
Carne preservada, carne seca. Que cuando uno tiene esos munchies, esa carne seca, en inglés beef jerky,
esos son buenísimos.
te da para masticar y te quita
todo,
esas ganas. Un huevo hervido frío de refrigerador, tienes esa gana de, no sé, tengo ganas de comer algo, coge un huevo, te lo comes, te llena enseguida y te da ganas de masticar.
Carne seca. ¿Cómo es? ChatGPT nos
da
la respuesta.
Nos rescata. Ahorita va a ChatGPT.
Para todo.
Ahorita voy a sentar aquí a ChatGPT para que le dé la charla a ustedes.
Ya casi hemos terminado y hemos terminado todas las preguntas. ¿Algo que quieres hablar?
Algo que quiero hablar. ¿De qué pontifico hoy? No sé, no, que me
ejercicio, always exercise.
Exercise is good for your brain, it's good for your heart, it's good for your psychology, it's good for everything. Exercise makes your heart stronger. I'm going to tell you guys a little medical in the weeds. When you're morbidly obese, your heart is working really hard. Something called the afterload, the resistance to your heart pumping blood out of the heart through the body. That pressure goes up. So your heart is like working up against climbing a hill. It's really, really tough. And it gets bad enough that some people go into heart failure, congestive heart failure. The heart dilates and, the person is short of breath all the time, etc. It is shocking and amusing and amazing that when you have bariatric surgery and you lose your weight, your heart remodifies itself. It becomes smaller and stronger and it pumps harder. So something really funny happens, which is your heart rate, your basal resting heart rate goes down. And it's shocking that sometimes it goes down into the 40s. And I get calls from doctors who don't know this phenomenon saying, we need to do a big workup because this 33-year-old lady that you did a gastric bypass that lost 150 pounds, now her heart rate is all the time 45. And I go, good. And he goes, what do you mean good? I go, that's good. That means the heart is stronger. It doesn't have to beat as fast, because it's maintaining the blood flow by beating slowly and strongly. They're going to live longer. They have in their brain, when the heart rate is real slow in elderly people, it's a problem with the heart, with the conduction system that may need a pacemaker. But when the heart is really slow in young post-bariatric surgery patients, it's a good thing. It means it's a stronger heart that is going to be at less risk for future heart disease. So I tell them all the time, you do not need to worry that this lady's heart is 45. Does she ever feel faint? Oh no. Does she ever feel dizzy? Oh no. She feels great. That's the point. But it is a true thing that if you had successful bariatric surgery and you're relatively young, your heart rate is going to go low. And sometimes low that the doctors are like, whoa, it's too low. If you're not feeling symptoms, if you're feeling great, slow heart is good for you. When I'm in a good mood and everything is great, my heart rate is 60. And I'm very happy because that shows your heart is in good shape. When your heart has to work fast all the time, heart rate 110, 120, 99, your heart is in bad shape. So don't be surprised if you go to a doctor and the doctor goes, I'm concerned because your heart rate is low. it's good. And if your doctor has a doubt, have him call me. I'll tell him where the articles are that he shows it's good.
Well, we were here once again in your uncomfortable chair.
We're gonna get new chairs. I swear I'm gonna make me look taller, and they're gonna give me more hair. We're going to go to the gym. See you later.
Bye.